Well, hello, North Country, and welcome to another edition of our little corner. This guy hasn't stood next to me in, what, about a year? Mike Hildebrand, how are you?
About 13 months or so. It was shortly, actually, it was before we were opening the new emergency department. So it would have put us back in about August of last year.
Mike is in charge of public relations for the CVPH Medical Center, which is spreading out its tentacles into the North Country at such far distances it's sometimes hard to find out where they are. But you've redefined the whole term campus here. We're starting a new phase of our operation because last time when we talked about those emergency services, we were overwhelmed by the size of that project. So much has happened since that time that we have a lot of ground to cover today. I might say that this program is being recorded about the second day of October, a day when I didn't want to get out from under the covers this morning. There were snow flurries in Saranac Lake and Raybrook yesterday, and it was windy, but it's always warm inside any facility connected with the CVPH Medical Center. Does that lay enough groundwork for you, Mike?
I'm impressed, Gordy. You can just keep talking. This is going fine. I like this.
It is true. I serve on the CVPH Medical Center Foundation, so I get to get a sneak preview of some of these wonderful new projects that are going on, and I'm always impressed and amazed. First of all, tell us how that emergency room, we don't call it a room anymore.
It's a center, Gordy.
A center is happening, is how it's working since we talked to you last.
Well, it has worked very, very well. And I'll tell you, being quite candid now, we've been in it 13 months or so. Initially, it was a little rocky because everyone was adjusting to everything being totally new. You know, we showed your viewers all the new systems, the new equipment, and it's just a marvelous facility. There's no question. But, you know, that was a radical change.
Oh, boy.
It was such a radical change for everyone. And once we got through a few months of growing pains, our patients love the service. We send out patient questionnaires to about every third or fourth patient. And we have a company tabulate them and do a comparison nationwide with over 500 hospitals. And I will tell you, without revealing any numbers, I will tell you that at one time our patient satisfaction in the old facility was pretty low. And now we're very, very high, and it's working out famously. During the infamous ice storm, something that pleases me to no end. First off, we could have never survived that ice storm in that old facility. But the second thing that I think is so positive and is such a compliment to all the staff that helped design that, because it was the emergency care center staff that really worked out the design. We had people through the federal program that were here helping us out from Massachusetts General Hospital. Mass General's top 10 in the nation. They were so impressed that when they went back to Boston, we got a phone call wanting information about how we designed it and everything. You know, here's Mass General calling CVPH Medical Center in Plattsburgh for advice.
That's great.
So it's going well. It's going well. But equally well, the things that we've been doing off campus here that your viewers are going to see today.
We are going to tell you so many things. You better take notes. I don't know if we'll ask a test later, but you never know when you might have to avail yourself of some of the services that CVPH Medical Center in its new and expanded form will be able to offer you now and in the future. When I say expanded services, this whole outfit is just bursting at the seams. For example, where are we right now, Michael?
Well, we're in the building that many people still refer to as the paper cutter building.
Yes.
It's a 53,000 square foot facility that we purchased from Pyramid about 2 years ago. And right now we're in the lobby of the Diagnostic Center, and we're going to be doing a walkthrough with Todd Krampitz with that. We're going to be looking at the programs and services in the Women's Imaging Center. We'll be taking a peek then next door at the H.K. Friedman Renal Center. And then we'll also be talking about the new project that's going to eventually end up almost filling the complete 53 or 50,000 square feet here, and that's our ambulatory surgery center that we hope will be opening by July of next year. And That is going to be an exciting program, because what it's all about today, Gordy, we live in a convenience world. People want to get in and out, they want to park close, they want service with a smile, and yet they want the same high quality. And what we have found is that by developing these off-campus locations, people love it. The staff does a marvelous job. It is service with a smile. But the nice thing is, both here and at the Bayside Wellness Center, and if we have time, we hope to get over there. You park close. You easily can determine, that's the door that I go through. You're in. Someone's there to say, oh, yes, this is the place. Again, in and out. And it's a very nice location and very nice decor and great people.
It's amazing, because I feel, just based on what you've told me today, this program could last at least 24 hours, and then we could come up with topics for about 6 more, because a lot of things are happening right inside the CVPH Medical Center building itself in the near future, too. Right?
Oh, yes. I mean, we've got a project underway that will be remodeling our obstetrics program, creating a whole new pediatrics unit, all under the name of a Women's and Children's Center, a tremendous program there. Again, we're trying to be responsive. We're trying to provide the quality services, but we're also trying to provide them the way that people want them. And we believe that if we can do a really good job, and we're confident we can, that people are going to say, hey, there's no place I'd rather go for health care than CVPH in Plattsburgh, New York.
CVPH is proving that it is indeed a top-notch regional medical center.
Well, we have done a tremendous job over the last 10 years in recruiting physicians, specialists, high-quality people. We're very satisfied with where we are. Now, what we'd love to have would be about a half a dozen more primary care practitioners, but from a quality standpoint, we have top-flight people.
Michael, thank you so much for that amazing introduction. I can't wait for the rest of the show.
Well, I think you will be even more satisfied with the people who will be talking with you.
We were told we have 30 minutes in this facility, but we're not going to speed up our voices or talk faster in a high-pitched voice. Faith Ashline, how are you?
I'm fine, thank you.
I haven't talked to you in a while. Where are we now? You keep leading me into these wonderful places.
Less than a year, I guess, since we did this before. This is the Women's Imaging Center. This is the center that we moved from the medical office building. We had started a Women's Imaging Center in 1989, and we have now a new facility. The reason I spoke about a half an hour is we try to keep this a very private place. Women can come here, have a mammogram in and out in 15 or 20 minutes and really not run into anyone they know. It's very quick and very private.
We have talked many times, and we could devote an entire program or 2 or a half a dozen to this subject, but it's a very important one, and I think the education is starting to work now.
I believe it is. More and more women come every month to have their mammograms. We see an increase, a steady increase. We also saw a nice increase in 1998 because of Medicare paying every year instead of every other year. This gave those women the opportunity to come on a yearly basis. Also, the new guidelines where women are supposed to have their annual mammogram from 40 to 50, and this used to be an every 2-year situation. So both of those things have helped bring the women in. We still have a large majority of our older population that really should be screening and are not, and breast cancer increases with the increase in age. So this is where our goal is right now, is to try to get some of the older women in, especially the Medicare population.
Boy, am I pleased to see something like this developing, because the need has been so powerful. As many of my viewers may know, I'm a victim services advocate in the probation department here, and it tickles me to death to have my clients come in and say, guess what? I'm going to go and have a mammogram. You know, it empowers them to know what their health is and to be able to do it at a reasonable price.
We also are partnerships with the Clinton County Breast and Cervical Health Partnership Program for women who do not have the means to pay. We have programs all through the year. We also can help them to see their own physician and pay for the visit and the mammogram and pap smear. So we also have the means to help people who don't have the funds to pay.
Don't go without it. Check it out, right?
Check it out. You're right.
So what are we going to see here in the next few minutes?
Well, the Women's Imaging Center, again, from the privacy standpoint, this is the first waiting room where patients come with their sisters, neighbors, husbands, whatever. We have television and books, and they sit here and wait for the patient. Patient signs in and then proceeds to go around and do a private registration.
What a tasteful room this is. If the rest of it's half as good as this, I may come back. This is really nice. All right.
This is Carrie, and Carrie is
Carrie,
our
how are you?
receptionist, and she greets the patients and does the registration. We also stress pre-registration. It just makes it so much quicker. They can get in and out real quick if they make that phone call for pre-registration.
What kind of hours are we talking about, Faith?
We are open from 7 in the morning till 8 during the weekdays. We are open from 7 to 3:30 on Saturdays, and we are open on Sundays.
That's terrific. All right.
Pretty much takes all the excuses out for getting away from your job or times.
That's great. What are we going to see next?
We will go into the private part now.
Faith, you wanted us to focus on this certificate for a very important reason.
The Breast and Health Cervical Program in New York State is done by many counties. There are numerous counties involved. And Clinton County received the award this year for having the most Medicare patients in their screening. It was presented out at the Crate Center during the Seniorama, and we're very proud of that award.
That's what I mean about the education process working.
Yes.
People are getting the idea. And Calvin commented as we walked in here, it's hard to put myself in the position of a person wanting or needing these services here because of my gender, but I can just imagine what a nice experience it is for a gal to come in here and say, this is not the hospital. This is a wonderful, comfortable, home-like facility that I can go in and go out with tremendous convenience and get a service and get away from the quote-unquote hospital stigma. Huh?
That's right. It's very private, very pleasant, and we welcome them into our home. That's
great.
The point of it.
Calvin, follow us in here, and you come on in here with me, Faith, and tell me what we're going to look at.
Well, this is very pleasant. We have 4 waiting rooms and a bathroom in here, a restroom. It's all done in fancy colors, nice gowns, and we also have terry cloth robes. And then any patient who's cold or just doesn't want to wear just the gown, they have a terry cloth robe they can wear. And they change in here and go across to our patient education room.
This experience, it's positive for me already, just looking at it. Just the choices of colors, the way it's put together, the color schemes that someone might choose for their own home.
And just things like padded coat hangers are very cheap, reasonable, but they do give the woman a different look at it.
All right, Faith, we moved across the hall.
This is the education room. Every patient should know how to do breast self-examination and perform it monthly. So we show a video. It takes only about 5 minutes, and it teaches the patient or reviews the patient on how to do proper breast self-examination. The certificates on the wall. Mammography is the most highly regulated of all of our radiology area, or even many parts of the hospital. We're under the Federal Food and Drug, MQSA, and we have 104 regulations that we have to follow. Our technologists are very, very well trained. They are all specialty ART registered. They all do the BSc education program so they can teach the patients. And so all of their certificates have to be in public view so that the women know that they are in a certified facility.
Education is power, and when people learn about what we're talking about here, it diminishes the fear. And when we have experts working and we can talk to these people and tell them what might happen, what is happening, and what might happen in the future, it reduces that element of fear, and that's something that has been a concern for so many years.
It takes away the anxiety, and the anxiety level is very high when you're talking breast cancer.
It certainly is, but we're making so many strides. I don't know about you. You're in the business. I'm just an interested observer. But every night when I watch the news and I hear them say, we've got another tool to fight cancer, any kind of cancer, I cheer.
Yes, and on TV the other night they spoke about the numbers going down with all of the new research and improvements.
A lot of it has to do with getting the people in there.
Yes. One of the things that we're very proud of in here is we are hooked to the internet, and the patients are free to sit at the computer and read. We have 5 cancer sites already programmed, and they're also free to go into other sites to read. We do have patients who will spend 2-3 hours reading and then find something they really want, and we print it for them.
And great resource.
It is. Patients just want a private, quiet place, and they want to know more about it. If they've had, this is possibility of a lump or whatever, and they want to go in, they want to read. It was interesting because Todd, about a year ago, said he had seen something where people research the internet, women with cancer, in the middle of the night. And on national news last night, that was also said, that women go into the internet during the night. Yep.
Lots can be said about the internet, but its potential resource for information is absolutely incredible.
It is. It is.
We're in mammogram room number 1. I read the sign.
Yes, we are. This is our newest unit. It's a Sophie. We bought this one for 2 reasons. It's the latest technology, and number 2, it's a mobile unit. We can take this out to the community. We have been out to several fire stations on Saturdays and done screening mammograms. It's mobile, and so we can use it as a fixed room during the week, and on Saturday or Sunday take it out into the community. And it's the latest technology. We use a heating pad to be sure that everything is warm for the patient. We try to take all of these things into consideration.
The process itself is not nearly as frightening as it was many years ago, and this looks like a gentle machine to me.
Compression has always been an issue with women. In the older days, they thought, or previous years, I should say, they thought that compression to the point of hurting the patient was the only way to get a good exam. But they quickly learned that if you hurt a patient or you use too much compression, they won't return. So our goal here is to let the patient decide when the compression is enough, and we take the films or the study that way, and the patients return. The intent is not to hurt them. It's only to spread the tissue out so that we can see better, use less radiation, and it's to the benefit of the patient to have good compression, but it should never be to the point of hurting you.
Well, for the benefit of many laymen who may not understand what a mammogram does, explain what the process does and what comes out the other end.
It's simply an x-ray of the breast. We have special films, special cassettes that use low radiation doses, and it's simply an x-ray. It's an x-ray of the breast with special films, special cassettes.
What does it tell you when it gets all done?
It would tell you if there were, like, cancer, of course, but it also tells if there are cysts, fibrocystic changes, normal tissue. It's a roadmap. It's a roadmap of what your breasts look like. And that's the reason that women between 35 and 40 are urged to have their first baseline mammogram so that we have something to follow the rest of their life. Then from 40 on, we can always go back and compare to the year of 35 or to 40, and we see what they used to be, and if there are changes, it's easily noted. That's interesting, too, because we don't ever discard our mammograms. Those are kept forever. We can always compare them.
Oh, that's great to know. As we talked about the education working, especially here in the North Country, you people have been stalwarts in that respect. Is there still a low level of resistance among women who just don't get it?
There's still some out there that come in and this is their first mammogram. We hope that this outpatient center is more convenient, less intimidating. We do more education. We encourage them any way we know how. And every once in a while, someone, a neighbor, will talk someone into coming. A sister will talk a sister into coming. Or a sister, actually a daughter, will talk a mother into coming. The mothers come in with their daughters, and it's their first mammogram. But if they could only do it once and realize that 15 minutes and it doesn't hurt and it was quick and private, they would come back.
I don't know about our viewers, Faye, but I'm so pleased that you allowed us to come up here today, because every time we turn that camera on, I get an education, and this is, I think, a very important chapter for me.
Oh, we're pleased to have you. We always like to show people around and show everyone what we have.
What an amazing, wonderful, tastefully decorated and efficient facility, and it all boils down to service, doing what we're intended to do in a way that's not obtrusive and is actually not unpleasant at all.
That's right. The patient comes back if it's a good experience.
So where are we now?
Well, we are in the radiologist reading room. This is where the interpretation of the films take place. There's also a table in here where the patient can be examined, and every patient who comes with a problem, a lump, may end up seeing the radiologist, looking at the films and discussing the situation. Some patients come back for additional workup if we happen to see something on the original films. It might just be a crease of tissue or whatever. The radiologist may say, no, that it was just tissue, they're okay, and the patient goes on their way. But there might be something a little bit more serious, and at this point the radiologist would meet with the patient. And I would like to introduce you to Dr. Charles DeLise, and he will take you from here. He would also be covering the diagnostic side. We have a reading room on this side just for mammo. We've kept it very private, but there is a door that takes us to the diagnostic services, and over there he has another reading room.
That's terrific. I can't wait. Thanks again, Faye.
You're welcome.
Dr. DeLise, it's so pleasant to meet you. We've heard so much about you. This has got to be a very pleasing field for you, very satisfying, I should say.
It is, Gordy. It's a challenging field. It's fun. It's a very important part of medicine, a diagnostic aspect of medicine. It is really that. It is where the diagnosis is made, not only here in mammography, but on the diagnostic side in plain film and ultrasound, and of course at the hospital in CAT scans and MR. And it is a key element in evaluating a patient's disease. It may be the tool, the only tool that reveals really what is wrong with the patient. And sometimes we're surprised what we find. But particularly in the last 15 to 20 years, with the advent of computers and computerized imaging and the application of computers to imaging, there's literally been an explosion in diagnostic information and what we're able to reveal in the way of body parts, if you will, and what's wrong with them. And it's actually a vastly different practice than when I trained. I trained at Upstate Medical Center in Syracuse in 1971 and 1975, and at the present time, probably a third to 40% of what I do, I wasn't originally trained to do.
Well, your education is expanding as you go, isn't it?
Well, I think that's the thing to remember about medicine. It is always an evolution. You know, we're always, sometimes asked, well, you doctors say one thing one week and there's something else the next week, and we've all heard that, and quite honestly, we as physicians don't like that either. I mean, we all kind of like stability. But medicine is something that is always in evolution. Imaging in particular, as I just said, is something that has undergone a tremendous evolution in the last 15 years, and I think has brought a tremendous benefit to society.
That's the bottom line. The service to the patient, adding to better health and long life is something we all strive to do, no matter what field we're in.
Absolutely, Gordy, a quality of life. And the facility here accomplishes that in a particular way, in that everyone is interested in service, and of course we're interested in maintaining quality and accuracy. And I think we've managed to do that. The revolution in medicine, and I hate to use the word because I don't like it myself, and it has, fortunately, fallen on bad time. It's called managed care.
He said it now. He's got that out of the way.
But the thing that it has done is it has brought good industry practices and quality control, continued quality improvement to medicine. Not that it wasn't here to the level that it presently is here. It is something that we think about and we literally do every day. It has become a part of our daily life, seeing how we do, how we perform, how can we improve that, how can we make it better, not only from the service aspects, which has a lot to do with why this facility is here, but from the diagnostic aspects. Is there something we could have done in a different way to get somebody through sooner, to make a more complete diagnosis more quickly? But it really has done that. And although we all bemoan the considerably additional amount of work that it brings, it means reviewing, 10 to 25% of your day's work, and think about that. Work your full day and then sit down at the end of the day and review 10 to 25% of what you've done. And that is, if you will, uncompensated time, not only for us but for the hospital as well. And in the challenging times, of course, cost containment, we've had to bring that into the formula and absorb that, and we have. And as much as people bemoan managed care, I think it really has brought an emphasis and focus on quality, and has forced us to structure our day and our practice with quality parameters built into it. And I think that we are delivering faster, better service without loss of quality and accuracy, and I really think we probably have improved quality. I have to say that.
That's wonderful. Tell us what happens in this room.
Well,
You don't just look at pictures that are taken here, do you?
No. This is the mammographic side of the diagnostic center, and on the other side of the facility is plain films and ultrasound, which would include chest and extremities and gallbladders, blood vessels. But in this particular room, this is the mammographic reading room. And this whole facility, the Women's Imaging Center, is dedicated to mammography. And it is also the most, outside of the blood bank at the hospital, the most rigidly controlled facility in all the diagnostic center. There's a federal review by the FDA. There's review by the American College of Radiology, which really I have to put a plug in for myself and my colleagues. It really is something that the American College of Radiology accomplished. About 10 to 12 years ago, they began to look at the quality of mammography and started a program to, on a nationwide basis, improve the quality of mammography. The point being, if we're going to sell screening to the public as a way of finding early cancers and improving survivability and improving cure, we better make sure that we're doing a good quality job, and we better do our best to see that that's a uniform quality job across the nation. And as a result, the American College of Radiology started an accreditation program, which really was the template upon which the federal government and state governments have built their programs. So we as radiologists are really very proud of what we've done in mammography. But this is, as I said, the most rigidly controlled area in diagnostic imaging. We look at everything from not only how well am I doing, but literally to how much dust is on this view box, and we've got to clean it. It is. Okay. And if you take a look at this view box, it does a number of things. For one thing, I would read with the lights off, and I don't know if that's going to affect what you can do. But it's very important that I try to keep out what's called ambient light, and I can press that button, and I can breathe shades in that cut down on the light, cut down on the glare, will allow me to see things just like having headlights in your eye. You can't see that, deer or person in the road. Same thing exists here. If you have too much light shining in your eye, you can't pick up some fine detail. So this unit itself is a controlled unit, if you will. It has to be able to produce so much light. It has to be able to produce so much shading. It's supposed to enhance our ability to accurately read the mammograms. So what we do in this room is, and this also has to do with service and throughput, this is an alternator that is loaded with case after case of mammograms. And it allows us to move through and read a large number of mammograms in a timely fashion. Throughput, if you will. And also improves our accuracy in that it's built to specifically do this. So a large part of the time when we're in here, we're reading mammograms. And mammograms are divided into two categories. There are what are called screening mammograms and are what are called diagnostic mammograms. And screening in general means looking for disease in otherwise healthy people, whether it's skin screening for colon cancer, cervical cancer, breast cancer. That's what screening means. So that's a large part of what we do. And fortunately, 97% of the screening mammograms are normal. Okay? We have to look at a lot of normal breasts, if you will, to find disease, significant small amount of disease. The other category of mammography is what's called diagnostic mammography. That's a patient who has a problem. They have a lump, they have a thickness, they have a pain, they have a bloody discharge, they have some symptom. And that requires a different evaluation. We not only do our basic 4-view mammogram, but we'll do additional work. And on this view box, you'll see a series of additional films, if you will. Additional views we can take, rolling the breast sometimes in different projections, trying to, if we see an abnormality, trying to figure out if it's a significant abnormality. And I want to make a very important point here. There was an article released a few months ago, and it was in our local paper, and we responded to it as well, and that is the callback. The woman who comes in for a screening mammogram, and then she gets this frightening telephone call, you've got to come back for more studies. And
well, we're powered up again with a new battery, Doctor. You're talking about that frightening call.
That frightening recall, Gordy, that you've got to come back for more views. A message I want to get out, and it was a message, the real message of this article a few months ago, that actually was written by a female general practitioner, and wrote it to intentionally try to allay the fears a woman has when she gets this recall. Because the vast majority of the time when you're recalled for additional views or additional evaluation, it turns out to be benign. So please keep that in mind. I know that's all easy to say. But what we do is an additional evaluation to try to find out if an abnormality that either is felt or that we perceive on the initial screening mammogram is real. And if it is real, is it a significant abnormality? There are lots of lumps and bumps and calcifications and densities on mammography that are benign. And sometimes we can clearly tell you that. This particular mass or density is benign, don't worry about it. There are other times when it has the bad look to it, and we're very worried that it is malignant. There is another piece of diagnostic equipment that we use in helping ourselves determine what might be going on in the breast, and that's an ultrasound machine, and we may get an opportunity to look at that when we get onto the other side of the facility, Gordy. And it's sonar. It's like a fish finder, if you will, to bring it to common terms.
You got it right down to my level. I can relate to that.
We may want to edit that part out. But it is the use of sound waves that are sent into the breast to detect structural changes and masses. And it actually is somewhat more sensitive than mammography in determining what masses are. And we often can tell whether something is a benign cyst, whether something is a more significant lesion. And with ultrasound, we're also able to do biopsies, diagnostic, surgical-like biopsies. With some local anesthesia and a small skin incision, we're allowed to pass a needle into the breast to the area that we're concerned with, that we observe under the ultrasound, and literally take a needle biopsy piece of specimen. As I said, very similar, and as far as accuracy is concerned, as accurate as a surgical biopsy.
And even that process is not extremely intrusive at all, is it?
No, it isn't, Gordy. You know, much more like, if you will, going to the dentist or going to your private physician for an in-office procedure. And again, it's one of these things that frightens everyone. None of us want people coming at us with needles. But I have to say, more often than not, most of the patients say, my goodness, that was not nearly as bad as I thought, and I think I'll get up and go shopping. So it is something that fortunately can be done in a way that it isn't painful and can give us a very quick and accurate diagnosis. And again, it's something that we can do on the same day that you come here. You come in with a lump, you're very concerned. By the time we leave here, we will have tissue that's been sent off to the pathologist, and he will tell you within a day whether this is something to worry about.
Time is of the essence.
Time is of the essence for all of us. No one wants that lingering doubt or concern that I've got something going on wrong in my breast. And if they do, then I want to get to it and get it taken care of as quickly as possible.
All of this to make an excellent point, which is really the bottom line of the whole discussion. The alternatives could be horrendous, And you can't do any of this unless they make that first visit.
That's very important too, Gordy. And that is another message I'd like to get out is please get your screening mammograms. A combination of breast self-examination and physical examination and mammography are at presently the best tools we have to find occult breast cancer. Occult mean hidden, something you can't see or feel. And mammography stands alone as the single best examination we have to find occult breast cancer. And we can find cancers 2 millimeters in size. If you know how big 2 millimeters is, maybe an eighth of an inch. And at that size, it is curable. And really at sizes bigger than that, probably up to 1 centimeter, it is curable. So mammography is capable of doing that, and that's the whole point. There have been multiple studies done in Europe and the United States that show the value of screening mammography, that we can save lives and improve survivability. I think that's unquestioned at this point. And again, to get back to my point about medicine evolving, at the present time, this is the best we have to offer. It's a good tool. It takes about 20 minutes. Women are always concerned there is a compression aspect of the examination that some people find painful and uncomfortable. That can be controlled. We help the patients with that. And it is a very important part of getting a good examination. Compressing the breast and making it one uniform thickness allows us to see through the breast in a uniform way. And will bring out densities that you can't see unless you compress the breast. So I have to say, if it is a bit uncomfortable, try to endure it. It's only a few seconds. It could mean years of additional life.
And you know, you mentioned breast self-examination. You think that discussion alone would be redundant in this day and age, but we're still educating, telling people it has to be done.
Gordy, I read an article just 2 days ago exactly stressing this point, that even though we have all of these modern tools available to us and this information is out everywhere, I noticed you were in the other room with the internet access that most of us have in our homes nowadays, and it's in the paper every day, it's in the journal every day. This article was making the point about 2 patients recently seen with, if you will, gross breast cancers, large masses on the breast that already had ulcerated. And both patients had, within the last couple of years, been to medical facilities for other health problems. And in this day and age that a breast cancer should evolve to that point where it is a gross, hard, ulcerating mass is hard to imagine. And you know, all of us don't want to be sick, and sometimes we ignore sickness. We do. It's obvious that these 2 patients ignored their problems for a long time. So again, please have your mammogram. Have it yearly if you're 40 or older. And don't be terrified if you get a call to be recalled to get additional views and additional evaluation. It is probably going to turn out to be negative. The vast majority of the things that we do turn out to be negative. Even those we send off to biopsy, 80% of the time turn out to be negative. So I know it's difficult to endure the process. It is for all of us. But in the end, it's going to be well worth your while, and it's going to be worth the while to your family and your children and all those people around you.
What an eloquent spokesman you are. I'm so pleased we came here today. Thank you so much, Doctor.
Well, I appreciate that, Gordy. Thank you very much. It's something that I like to do. And the thing about me being in medicine is a double-edged sword. There is the ability to do great good. There is the ability to do harm. This is one area where we can do great good, and if you know how to use the tools that you're given, and you watch what you're doing, and you're in a good controlled environment like this is a great opportunity to do great good.
Todd Krinkbitz, it's time for your 15 minutes of fame. He's been on the periphery here all day long. What's your function here, Todd?
I'm the Director of Diagnostic Services at CVPH Medical Center, and that really means I'm in charge of the lab and radiology.
Oh, wow. He says you can tell we're a little bit proud of our facility. How could you help it? What a wonderful place. We're on the other side of it now. Tell me what we have over here.
On the other side of the facility, we have a registration area, and then we also have basic laboratory facilities and an x-ray room and ultrasound services. It allows the patients for the routine and easy things to come in, have your blood drawn quickly and leave, and routine x-rays. Dr. DeLeese talked about plain films. It's the chest x-rays, the hands, the feet, the knees, that sort of thing. The routine things that you don't necessarily have to go to the hospital for, just need to get in and get out.
And boy, that seems to be the way it works in here.
That's right.
I've seen it happen all morning long.
If the patients use advanced registration, then they don't have to wait in those real long lines. The basic of the center that happened a couple of years ago is we took a look at all those information sheets that you get bombarded with after you visit the hospital, and we take them pretty serious at CVPH. We look at every single one, and when we had an opportunity to build a center, we wanted to look and build something different that the people wanted. We had problems with parking. We picked a spot with very, very close parking. We had problems with registration. We've redesigned our registration area. You can do it over the phone. And just to make it easy, get in, get out, a lot of our patients come in before work. They stop in after work. We have Saturday hours, and we don't have to interrupt your work schedule, because that's gotten to be a real important thing for the patients, is not to interrupt their daily activities. They have families to take care of too, so we want to fit into their schedule.
That time element alone has got to be a benefit, to have somebody be able to come in here and get out in a reasonable amount of time. Far different cry from the way some other things operate in our lives, where we have a half an hour to get a job done, and it takes us a half an hour to find a place to park before we ever get in for the service.
That's right. We did not try to do everything here. We don't offer all the services that the hospital offers. We offered those services that the patient's not at risk of anything really going wrong. We wanted to do those things that are non-sick activities. You need to have a blood drawn to monitor some type of medicine that you might be on, or what your physical status is. If you need to have an x-ray because you fell down and hurt your foot last night playing soccer, something like that it's quick, simple, and we get that information back to your doctor right away.
I love it. You sold me. You're a good salesman too. What are we going to see next?
Well, we're going to poke our nose into the laboratory, because after they've registered, they've come in. You'll find that it's a separate area, because you really don't like to have your blood drawn with everybody looking over your shoulder. We've got a nice separate area, and we'd like to show you that.
Okay. All right, and that's where we went, even though the camera didn't follow us down the hall.
What we happen to have is one of our blood drawing areas. They're separated by some walls to keep it as private as we possibly can. And we have this little chair here that happens to look a little bit like a barber chair, but we tried to design something that's easy.
A little light off the side.
Yeah, it's easy for the patients to get in and out, and also works very good for the staff. We worry a lot about the staff. We wanted something that was convenient and bright and airy for them. And this particular chair locks, and it also swivels, and it pumps up for the shorter of us patients who have to get in the chair, that the patient, our employees aren't bent over, so we don't have to worry about repetitive motion injuries. So we tried to design lots of things into the plaza, not just for the convenience of the patient, but also to take care of our staff too.
I imagine the staff kind of likes this facility, don't they?
Well, the staff had a lot to do. The doctors were involved in its design, also the staff. We went through multiple different drawings to try and come up with the best possible solution that we could. We worried about having enough light, because we didn't want a dark facility. The facility was decorated by the employees. We didn't have to go out and hire a decorator to do it. They wanted something specific. The pictures on the wall were taken by one of the employees.
Come on!
Yeah, Mr. Joe Rector.
Wow.
So it's very much an employee facility. We're also very proud that we don't have a supervisor here. Yes, I'm the manager of the lab and radiology, but we're connected by pagers and telephones. We don't have somebody here. It's the employees. They're a self-directed work team, and they're able to work on a day-to-day function. If there's a problem, a supervisor is a phone call away. So we're very proud of the employees. They've done an excellent job. We've been open for 13 months, and it's we're not perfect. We still have a few things.
No, you're not perfect. You could have fooled me.
Well, it's a good thing, and the employees make it good. And we're real, real proud of everybody that works here.
I am too. It's a wonderful facility. Sometimes the best comments come when you're walking down the hall and the camera shut off, and so I have to reiterate. I might even recapitulate. We talked, Todd and I were talking about ownership. As Calvin and I were saying, yeah, you might save money by doing the work yourself, having the people have an input, doing the decorating, using local labor, but it has to do with ownership. As I say all along, and we work very hard with the CVPH Medical Center Foundation, we try to tell people that this is your medical center.
Very much so.
And that includes the employees.
Absolutely. The employees had a chance to help in the design of the facility. They maintain it. They actually self-direct it. It's been a wonderful opportunity. As you take a look around, we've been open 13 months. We don't have the obvious wear and tear of a lot of buildings. We see a tremendous amount of patients through here. Over the course of a year, you'll see almost well over 40,000 patients come and go.
No. 40,000 patients?
Right. We'll see the mammography area sees 50 patients a day. The laboratory sees 100 patients a day. This X-ray room that we're standing in right here sees almost 50 patients a day. In fact, they might ask us to leave here pretty soon.
I was worried about that.
Or we might need an X-ray. But we're real pleased. And again, as the waiting area is not real large because we don't need a real big waiting area because we try to get people in and out. We've been very pleased. The employees take great pride in what they do, and they coordinate everything. So it's kind of nice for me.
It's great for everybody. It sounds like you got pretty close to a perfect picture.
Well,
even though you said you weren't perfect, Todd.
No, we're not perfect. To give you an example, we started out a little over a year ago in a facility right next door, a little 10 by 12 room, and we drew blood. We had 30 patients a day. Now we've grown. We've had to add staff continually. We've gone from one person drawing blood a day, now we now have 4 at certain times. And just like Disney World, who probably handles people the best there is, we sometimes have problems too. And we try to stay ahead of all that. We evaluate the amount of people that go through here every day. And out in front, there's those little handy-dandy green forms that we ask people to fill out if they've had a bad experience or a good experience. Because Mr. Carroll, our CEO, reads every one of them. And it's important that he gets a chance to see those. My boss, Mr. Wallabin, sees them, and we take them very serious. We have an empty room. It's not often that a new building is built with an empty room. It's unfinished. It's for things that we plan to do in the future. We're very fortunate being able to do that, and we're already making plans of what we want to put in there.
Oh, the future is very bright for this facility and the rest of CVPH. Thanks again, Todd.
I appreciate it very much.
We, as you can tell, we didn't spend weeks planning this program today. We're kind of winging it and talking to the people as they're available. I wanted to spend a few more minutes with Dr. DeLeese. He's such an interesting person, and every time I speak with him, I learn a great deal more. Calvin pointed out something that I hope didn't either disenchant or confuse our viewers when he said things are turning out negative. That's a good thing for him and a good thing for you. When you're looking at mammograms and things are negative, that means they're not finding things that are bad. So I want everybody to know that things are going very well over on that side. Kim Dowdle, how are you?
I'm very fine, thank you.
I'm doing terrifically well. I haven't been in this side of the facility since it opened, and that was kind of an exciting day, that open house, wasn't it?
Yes, it was. We've been here almost a year and a half now.
So let's explain to our viewers where we are and what this facility does.
Well, this is the H.K. Friedman Dialysis Center, and we have dialysis patients here from primarily Clinton County. We have a few from Essex County and some from Franklin County as well. Roughly right now we're dialyzing about 66 hemo patients.
It's possible that some of our viewers have no idea what dialysis is all about. This is a beautiful, bright, clean facility, but you talk about convenience and service to customers or clients, whichever phrase you choose. What a wonderful place for them to come. Explain what dialysis is about.
Well, dialysis comes about when people's kidneys fail, and kidneys can fail for a variety of reasons. Diabetes, high blood pressure, some is hereditary. And when people's kidneys fail, that means their blood does not get cleansed the way it's supposed to, and they therefore have to come and have their blood cleansed through a machine or the dialysis machine.
Now, do some people who are candidates for kidney transplants usually have to go through dialysis for a certain period before that happens, or?
Well, if their kidney failure is caught soon enough, they can be placed on a kidney transplant waiting list, waiting a cadaver kidney, or if there's a family member that's willing to donate their kidney to them, then they can have what's called a living-related transplant. If people do not have relatives in which to get a living-related transplant from, then they would go on a cadaver list, and if their kidneys continue to fail while they're waiting, because you can wait a year or more for a cadaver transplant, then you would need to go on dialysis, yes.
We heard some wonderful stories in the media over the last few years about family members donating kidneys. It's just gives you that feel-good feeling.
Yes, yes. We had 2 this summer. A young lady and also an older gentleman had his brother donate a kidney to him.
We all go back in time. Of course, I've been around here almost since those things were invented that Calvin has on his shoulder over there taking our pictures. But I remember the classic case was our late friend Michael Finnegan, who was one of the longest surviving kidney transplant recipients, having received a kidney from his own brother on Thanksgiving Day many years ago.
Yes,
So
I remember Mike from downtown Plattsburgh, yes.
Sure. How could you help it? So tell us a little more about what goes on in here and the fact that dialysis is not as, to use Calvin's word, negative again, not a very negative thing. I see people back there with their earphones on and books and just, well, this is what I got to do. I'm going to enjoy the time.
Right. Well, I should point out that once you usually start kidney dialysis, you need to stay on it for the remainder of your life. It is a life-sustaining procedure. We do have a rare instance where a person's kidney function may resume, but I do stress that that is generally rare. And what we try to do here as staff is make this as a warm and welcome place as possible. Patients, when they come, are here for roughly 3.5 to 4 hours. They're allowed to watch TV. A lot of them sleep, bring reading material. Their family members can come and visit with them. And I would say for the most part, if you talk to the patients and the staff, you will find that it's a family atmosphere here. We consider this, we have parties, we celebrate the holidays, we try to make it enjoyable.
And patients come here from some distance.
Yes. Actually, with the Malone unit opening, we don't have as many people coming from that way, but we've had people travel well over an hour to come to us. Right now we have a woman that comes from Tupper Lake 3 times a week. We have people that come from the Keysville, Ausable Way, Champlain, Rouse's Point, and the surrounding Plattsburgh area.
And once again, we have a tremendous amount of parking. It's convenient to the Northway, to the malls. It's and once again, it's not having to go into a huge medical center to get the job done. We're back to the convenience for the people who need the service.
Yes. A lot of people have noted that we're all on one level here, which is very nice. No more use of an elevator. A lot of people that formerly would have had to come in wheelchairs now can walk in because it's not that far to walk in from where you get dropped off just outside the door and to come in. So it's been a big improvement as far as that goes. And we're much roomier. We used to dialyze from 6 o'clock in the morning until roughly midnight. Now we start at 6 o'clock in the morning, but we're generally done by 4 or 4:30. So it's much better.
Michael told us we might even have a patient that would be willing to talk to us after.
Yes, we have a lady that's in her 80s, and I think you'll be surprised to note that. She's a very lively young lady, and we enjoy her very much. So we can go and chat with her.
Okay, Kim, where are we now?
Well, we're inside the dialysis unit, and we have a hemodialysis process going on right now. And what happens is there are 2 needles inserted into the patient's arms, and with one of the needles, the blood is transferred into the machine where it is cleansed or dialyzed. This is the actual, what they call the kidney for the dialysis machine. And it's full of a lot of little fibers, and it goes through there and it's cleansed, and there's a lot more to the process which I really don't know about. But once the blood is cleansed, it goes back into Evelyn's arm through the other needle.
That's wonderful. Now I'm going to sneak over here, Kim, and meet Evelyn. How are you?
I'm fine, thank you.
I forgot your last name already.
Prosper.
And where are you from?
Plattsburgh.
Oh, terrific. Now explain to me why you have to be here.
Well, my kidneys have failed. And I've been on this treatment for 3.5 years. And that's what you have to do. You don't have a choice.
How often do you come in, Evelyn?
Monday, Wednesday, and Friday, 3 times a week for 4 hours a day.
You seem to be doing very well. How do you pass your time when you're in here?
Well, sometimes I sleep, sometimes I watch TV.
It's nice to have all those options.
Yeah.
Maybe stay up a little late at night so you can take a nap when you come in here. Evelyn, tell me a little bit about yourself, where you were brought up and what your life has been like.
I've lived here in Plattsburgh most of my life. And what else do you want to know?
Anything else that you want to tell me about your life?
I seem to have an average life. I have a son and a daughter-in-law and 3 grandchildren.
Hey, that's something. Do they all live around here?
They live in Connecticut. Yeah.
It's not fair.
No, it isn't.
Do they come to see Mom and Grandma once in a while?
Oh, yes, they do, and we visit them. Just came back from a wedding last week.
Did you really?
Uh-huh.
How do you work that in between the dialysis?
Well, I make appointments to have dialysis in Connecticut. Kim makes them for me, usually.
That's a nice service, too, so you can travel.
Yes, so, yeah, works out well.
Where do they live in Connecticut?
Simsbury.
Oh, yeah.
You know the area?
Yeah, that's a beautiful,
Avon.
beautiful
Area
place.
in Avon.
So you do get to see your family every once in a while.
And they come here often, too, to visit.
You were born and brought up right here in
Born in Lake Placid, and lived in,
in Lake Placid.
yep, and lived in Plattsburgh most of my life.
There are a lot worse place to live and raise a family, aren't there?
Oh, I think so.
I know I've enjoyed it. I'm a relative newcomer. I've only been here since 1961, but I have enjoyed my stay in the North Country. Got to meet a lot of good people.
It's very nice here. Beautiful, the Adirondacks. And that trip from here to Connecticut, gorgeous through the mountains.
And if you were to take it like next week when all those leaves are at their peak, that would be amazing. But you've done that before too, right?
Sure, sure.
I wrote a column for the newspaper that'll come out in a little while about leaves. I've taken so many pictures of leaves that my family gets bored seeing them, but fall never ceases to amaze me.
I love fall. Kim takes a lot of pictures too, so she probably has some.
I have way too many, and I inflict them on people, you know. But that's all right. I do think we live in an exceptionally beautiful part of the country.
Yes, we do.
Many years ago, when they designated part of the Adirondack Northway the most scenic highway in America, I was pretty proud, and I still am.
Yes, it's beautiful. Beautiful.
Well, I'm so pleased to have you here. What interests do you have? Do you have hobbies and things? Or?
Well, I knit, crochet, read.
Those are 3 fun things.
Yeah.
I don't know how to crochet, but my grandmother or somebody taught me how to knit when I was a little guy, and I can remember I broke my leg and I learned how to knit, but nothing fancy. I think I could remember how to do it. I remember the phrase cast off. I have no idea what it means anymore.
That's probably at the end of the project.
Like I don't like what I did, so I cast it off. So
You cast on and you cast off.
what kinds of things do you make?
I make tablecloths, doilies. All my family love them. I make them and I give them away. I don't have too many of my own, but they have houses full.
I have seen the most incredible tablecloths and doilies. The fine work amazes me. They make nice family heirlooms.
They do. They do. Yeah. They love them.
Made a few, huh?
Quite a few.
More than you could even count, I bet.
I'm sure.
How about Afghans?
Oh, I made those too. I'm away from that now, but I have done. I've done those.
My wife gets into the Afghan groove, you know, and I have a granddaughter that started college at UMass this year. Grandma, you have to make me a special kind of Afghan, and then she ended up with 2 or maybe 3 to go away to school, but it makes her feel close to Grandma.
I did that too for all the kids that when they went to college. They all took one.
It's amazing how the same kinds of things are going on in different families all around the North Country. Well, guess what? It's been a real pleasure for me to meet you, Evelyn.
Oh, thank you very much.
Maybe we'll come get a chance to do it again sometime.
Yeah, good.
Thank you. Have a great day.
Thank you very
Make
much.
sure you hug all those kids.
Yeah, okay.
Calvin said we're going to shoot a few shots out the window in case anybody's confused as to where we are. My whole life is mass confusion. You get me in these buildings, and if you ever left me in the back, you wouldn't find me in time for lunch tomorrow, I think. But we are in another part of the same amazing facility that people used to know as the Paper Cutter Mall or whatever next to Hannaford's. Dave Cavanaugh, how are you?
Good, how are you?
I'm pleased to meet you today, and I'm just fine. What are we standing in? What is this end of this facility going to be?
Well, we're standing in the shell of what's going to be the new ambulatory care unit, ambulatory surgery for the medical center. We're moving the bulk of our outpatient ambulatory surgeries and endoscopies off-site, off the main campus, to this location where we can hopefully improve services, give a little bit better environment, more customer-friendly, a little bit more family-oriented, quicker, better, faster service.
We've been talking about service to the customer, and that's exactly what this place will mean. David, tell me about you. What do you do, and where did you come from, and where are you going?
I'm a North Country native. I was born and raised in Chateauguay, went to schools locally in Malone and in Saranac Lake. Have worked at the medical center here for, I would say, 13, 14 years. The last 8 or so which have been surgery connected one way or the other. Focused in ambulatory care in the last couple years. Got asked to be on the project a good 3, 4, 5 months ago. Did a little traveling with the medical center looking at different things, and it's brought us up here.
You love it when a plan comes together.
I know it. I know it. It's exciting.
It's got to be exciting. This whole day has been so exciting for me because we're getting a view from the inside out instead of the outside in. All these things were a long time in the planning stages, and now we're watching it happen, and our viewers hopefully will be able to see the finished product when this end of the building is finished. Precisely what will be here now?
We are looking at a total of 3 endoscopy suites. So the bulk of our outpatient endoscopies and colonoscopies will be done at this facility. We're looking at a total of 4 operating rooms up and running when the project's at full speed, bringing the bulk of our outpatient surgeries, gastrointestinal, plastic surgeries, local little things that you used to go and get lost in the hospital for that you'll come and get done here now.
Well, what are we talking about timetable for this thing getting finished?
Well, the jackhammers are going. We're hoping that hopefully by the end of June, beginning of July of next year, we'll be opening the doors and be able to see patients.
That may be hard to believe as you look around this room and the adjacent room where things are happening, but you know, when you have a plan, maybe it will get there.
Well, they've been waiting patiently with the shovels ready to go to work. They've been waiting for the final approval from, I believe it was a certificate of need that was needed for the hospital. That's come through. We worked with the architects to get things lined up, and finally the stamps are getting sealed onto the blueprints, and things are happening.
Does it please you to have a big part in all of this?
It does. It's nice to have an employer that will put enough confidence to say, you know, sit down with us and tell us what you think, and listen to what you say.
Hometown boy makes good, huh?
I hope so.
Born and brought up in Chateauguay.
Chateauguay.
Went to
Chateauguay Central School.
Franklin Academy?
No, Chateauguay Central School, right in the village.
Yeah.
Still there and going strong. Local colleges and still right in town.
I love it, David. We'll find out. Somebody else is coming. I see them in the parking lot.
Yeah.
Who is that?
That would be coming through the door soon will be Nancy Liberty. She's an assistant nurse manager for the endoscopy unit. I think she's got some plans with her. She will hopefully be coming on site when everything's open to take care of running the gastroenterology part of it. She's been an integral part of the planning. She knows her stuff about the endo part of it, as well as the construction and the systems part of it more than I do.
She brought props.
Yeah, she's got toys.
Thanks a lot, David.
You're welcome.
Well, she made a very heralded entrance as we took pictures of her coming across the parking lot. Nancy Cavanaugh, how are you?
Oh, well, I'm Nancy Liberty to start.
What? No, that's Dave Cavanaugh.
Right.
Nancy Liberty. I'm so sorry. But this is typical Gordy Little. The longer you watch this program, the more you realize how confused I am over names. We're so pleased to have you here today and to bring this. We said you had a prop. Now you have to tell us what it is.
Well, actually, this is the blueprint that is the final set that we're working with the architects to get the building going. Actually, if you take a look here, Diagnostic Center is over where David's standing here in the facility.
Dave, you're the Diagnostic Center.
And patients will be entering here for their visit. And this is actually the exit going through right here. What would you like to know?
We're
Gordon?
hoping that this will be doctor's offices.
This will, hopefully that's what will end up here in this portion of the building.
It's quite a bit of square feet of space involved in this ambulatory surgery portion alone, isn't there?
Yep, it's about 22,000 square feet. Absolutely. Actually, I think what is the exciting part about this whole project is that we're going to be able to offer the community services that they now have to go into an acute care facility to be taken care of. And in some instances, I'm sure there's outpatients out there who have had surgery prior to this and have been bumped by patients who need to have an emergency appendix taken care of, or somebody's delivering a baby, something along those lines. This will be set up so that these people can actually present to a facility that promotes wellness in the fact that I'm not really sick. I'm here because I have a problem that needs to be taken care of. And so we'll be able to bring them in and hopefully not interrupt their care, you know, by someone who needs an emergency surgery. So they should be able to come in a much more timely manner and still get the same quality care that we offer every patient that comes into the CVPH institution, and be able to come in and a very timely, efficient form, you know, come in, have their procedure, and get out in a very timely manner.
That's something we've been talking about all day long about this entire facility. The convenience and service is going to be wonderful.
Absolutely. In fact, we do a lot of outpatient surveys in our institution, and a lot of the complaints have been parking. No place
yeah,
to
we
park.
mentioned that. Yeah.
And then actually to come into the institution and have a procedure done, it required that you had to find a place to park, you had to come in, you had to present a patient registration, and be it wherever your procedure or surgery was being done, you either went to the second floor or the fifth floor of the institution. This brings everything into one place for the patient.
Tell me, give me a hypothetical scenario as to the kind of patient who might be able to avail him or herself of the services up here once it's finished.
Let's see. Well, there's going to be some podiatry patients handled up here. There will be some dental, but say a person who's coming in for a bunionectomy. All right. So your surgery is scheduled to start at 7:30 a.m. You will probably be asked to present at 7 o'clock in the morning. You'll be able to drive up, plenty of parking, be able to park, come into the institution here, and we plan on, there will be someone manning this reception desk from the time it opens till the time it closes in the evening. All of the paperwork will have been compiled and the chart will be put together prior to you presenting to the institution for your procedure. You will be brought in and registered right at the reception desk, and one of the nurses will come out. Preferably the nurse that will be assigned to your room for that procedure that day will be the nurse that will come out, intercept you, do your interview, and she will also, or he may accommodate you right to the operating room and be the nurse that will be doing exactly what she described that she'll be doing for you. And then afterwards you will come out of the operating room, and depending on if you had general anesthesia or just some sedation for the surgery, you will be brought into one of the recovery areas and then brought into a phase 1 recovery where people go that have general anesthesia, and people who have just sedation will probably return to another area which is not as technical and high class, you know, as far as the training that's needed to take care of you due to the anesthetic that you received. Then you just follow right. You may even return to the cubicle that you were processed in for the procedure to be getting ready to be discharged to go home. And basically that's what we've got to offer.
It's truly amazing to me how the process leads to a blueprint like this, and then the facility partially completed here. How involved were you in that whole thing from the beginning?
Basically, I've been involved since the beginning of the program. I've been an assistant nurse manager in perioperative services now for 5 years, and actually have supervised all of these areas in my travels in the last 5 years. So it was really nice to be so involved, and we did bring in the staff themselves who are being involved on the daily basis of patient care, so that this would be set up so that the flow is perfect for the patient to come in, so that there's, you know, the route is set out, and you know, everything will be very efficient and timely. And also with the model of care that we really want to offer to the patient, continuity of care, having the caregivers only be maybe 2 nurses for a day rather than 3 or 4, is going to help. You know, it's going to be more for the comfort, to make the patient comfortable.
How unique is this setup compared to other facilities?
Actually, we've done some touring, and we did go look at some other institutions and facilities. We brought the blueprints with us on the last trip that we went, and actually they said if we had only known, we would have done this
Don't you
ourselves
love
prior
it?
to.
Yeah, we have other facilities saying, how are you doing? Oh, wow.
And so I think it was really great to have them offer, their input to us and let us go and actually take a tour of their institutions. And it looks like we're definitely on the right track. In fact, I think we have an advantage, I guess, by visiting them and letting us know what they would have done differently so that we could do it before we even get started.
But you can't wait.
I can't wait. I think it's just
Till
exciting.
that key is finally turned in the door.
Absolutely, absolutely. I think it's going to be great. I mean, anybody who has families that are involved and have had surgery before, this is just gonna make them not even having a problem thinking about coming down.
Wait to see what the questionnaires look like after we've been in operation over here for 13 months as we have down at the emergency facility at CVPH.
I don't even think they're going to compare. I think it's going to be great. I mean, it's actually a service that it's something that we do offer on a daily basis, but just doing to the physical constraints that we have, that's what causes us not to be able to offer something as timely and as, in a more customer-friendly type atmosphere. This is just going to be great.
That's wonderful. Now, Nancy, we asked Dave what his background is. Where were you born and brought up? And tell us a little bit about your life and your education.
Okay.
Any details you want to include?
Let's see. I was born...
This is unedited.
I was born at CVPH. Actually, it was Champlain Valley Physicians Hospital. Born and raised in Dannemora, New York. I did go to high school in Dannemora. I went to North Country Community College for my LPN when I graduated from high school. I was an LPN for 16 years at CVPH. 12 of that was spent on the evening shift working in the intensive care unit. Decided to go back to school in 1988. Walked out the door with my son who was leaving for kindergarten. I left to go back to school.
That's great.
And then from there, I actually went to work in the recovery room when I graduated as an RN. Went to the new endoscopy unit in 1991, and the position came up as an assistant nurse manager, and I just opted into it, and I've been there for 5 years.
These are wonderful North Country stories, and it's something we promoted for a long time. We have great natural resources up here, not only the timber in the woods, but the people who have been born and brought up in places such as you two have, to start your education in small rural high schools in northern New York, go on to attend North Country colleges.
Mm-hmm. And then I actually got my RN right here at Clinton Community.
Oh boy, now you're talking a language I can really understand, because we do have great resources here. Clinton Community College is involved in a massive expansion toward the technology of the future to train people for those kinds of jobs. Right. But it's wonderful that both of you have decided to stay here in this tremendous part of the country. Huh?
Probably because I was born and raised here. That's it.
You can't leave Dannemora.
No, absolutely not. I will stay there probably for the duration.
All right. You know that the name Liberty and even Kavanaugh, North Country names, right?
Absolutely.
You probably even know the Gilroys up there.
Oh, I graduated with Brendan.
I had to throw that in, You two are just absolutely terrific. Calvin and I promise to be back here when you open that door for the first time. Hopefully not as patients, but as casual observers.
Great. And we'll take you for a tour.
Walk
you through and let you see.
We'll be back. Thank you, Nancy
All right.
Liberty and Dave Kavanaugh. Did I get it right?
You got it.
Have a great day.
You too.
It used to be called the Bay Club, and now it's called the Bayside Wellness Center, and we're down in the other end of town as this CVPH Medical Center campus just expands all over the place. We're ready to meet Bob Wallaman. How are you, Robert?
Good, Gordy. Nice to meet you. Glad you could come down to the facility.
I said I haven't been down here in a long time, and this whole idea has changed a great deal down here, hasn't it?
Oh, it certainly has. You probably remember the club when it was known as the Bayside, or Bay Club. And about a year ago now, almost to the day, we entered into an arrangement to lease the entire facility and move our outpatient rehab department over here. So we've done that, and we're pretty proud of the facility. I think as you walk through, you'll see some things that we're doing a little differently here that are more convenient for the patients, and really first rate.
How does the YMCA come into it?
Oh, that's an interesting arrangement we have. When we released the facility, we wanted to maintain the club membership for all the community members who use the facility as a health club. But as a hospital, we're not really experienced in running a health club. So we went to somebody locally in town who had a good reputation and was doing a good job, and worked out an arrangement with the Y. They actually subcontract with us to run the health club, and they incorporate all the programs that they have downtown on the Brinkerhoff location out here as well. So you have aquatic programs for seniors, you have aerobics and exercise programs for younger adults, and it's worked out beautifully.
I like the word wellness.
Oh, yeah. Well, so many times you think of a hospital and you think it's the only place to go when you're sick, but what we're trying to do with this facility, and a couple of others that you've seen today, is really incorporate the concept of wellness and prevention. So, as an example, here we've got our outreach nutrition program in the space right behind you, Gordy, and that's a weight reduction, weight management program for people.
Look at my belly when he said that.
Look, we're all, Gordy, we're all in the same boat.
Yeah.
Okay.
Hopefully we're not all in the same boat, or that baby is not going to make it across the lake. Go ahead. I didn't mean to interrupt.
So,
a little humor there.
So we've moved that program over here. That's a prevention program. We're trying to keep people's weight at the right level. We've got some other programs back in the back that are related to physical therapy and occupational therapy. We call them ergonomic programs. It's basically working with employees who have specific job functions that might cause injury, and we work with employees to help them understand what are the things they should be doing at their work site to reduce the chance that they'll be injured. So we're trying to incorporate that in here as well. And then when you see the pool, you'll see that we have a whole program related to aquatic therapy and use of the pool, which really is all geared towards trying to keep people healthy. Because when people are sick, that's the worst time to be taken care of.
Did you have to make a lot of changes?
Well, we've put a substantial amount of money in the building. If you walk through, remembering the club as it used to be, it had a number of racquetball courts. We've converted some of those over to space that we think makes more sense for either a health club use or for the therapy use. We've put about $300,000 worth of renovation into the facility. So it's a significant investment for us, and we hope to be here for a long, long time.
Sounds like that well-worn phrase, win-win to me.
Yeah, definitely. Definitely. We took an opportunity to get into a facility that was unfortunately having some trouble, and we've breathed new life into it. It happens to have solved one of our needs. We were out of space on the main campus. If you've been down there, and many of your viewers I know go down to the campus, one of the problems is you park so far away, and then you got to walk a mile and a half to get to physical therapy. Heck, the joke we used to have is if you could make it to physical therapy, you didn't need it.
I love it.
So now you park right outside the door, and within 50 feet, you're into the therapy area, and you're ready to go. So
service and convenience, those seem to be a couple of words that we have been echoing since we started this program, and it certainly applies.
Right. Yeah. Again, it's one of the hallmarks of what we're doing down at CVPH. We're trying to make it more convenient for everyone who's got to come in to be taken care of. So we think this facility fits in beautifully.
And for those of our viewers who may not be from Clinton County, most people from our county know where we're located. People watch this program in Franklin and Essex counties as well. We're just a little bit south of Plattsburgh on what would be known as Route 9 North or North Margaret Street.
Right, exactly. Right down the road from famous landmark Gus's Red Hots. So if you know where Gus's Red Hots is in the beach, we're just south of that on Route 9.
We couldn't use the old orange julep because it hasn't been around here in years. You probably never even heard of that.
No. I've
There used to be a giant orange ball located here on North Margaret Street that was in itself a landmark in those days, but that's a whole other story, Robert. Are you going to take us for a tour?
Sure, I'd love to. Let's walk through the facility and we can talk and answer some questions as we go.
All right, we're walking. This in itself is exercise. Don't forget that.
Right, Gordy. What we've done is we've added in a full-service weight room for the health club members on the right-hand side here as we go down the main hallway.
You say full service, you're not kidding. There's some nice stuff in there.
Yeah, you can really pump some serious iron in that room. And on your left is a space that we've converted over to cardiovascular equipment, exercise, treadmills, stair steppers, those kinds of things. That's an area that many of the health club members can use, but we use it also a lot for patients who need that kind of conditioning therapy. Back behind these walls is our actual treatment space, and what we've done is we've actually doubled the amount of space that we've been able to previously use. So we can handle up to about 20 patients at a time, which is significantly more than we ever could before. And one of the beauties back behind, as we walk through, you'll see we have a separate area for physical therapy and a separate area for occupational therapy, because frequently they're different patients. And I know it's fairly informal, but here's one of our staff members who works in our aquatic therapy department.
I really wished you didn't introduce her today, but never mind.
Jenny's one of our all-stars. She'll do anything we ask her to, and she came right out of the pool to cover the front desk. So,
everybody out of the pool, right? Thanks, Jen. Yeah, thanks a lot. You're going to get yours, Bob, for doing that.
And as you can see, the therapy area is pretty spacious, and this is just for physical therapy. And we like to tell people that we're the full service therapy provider in Clinton, Essex, and Franklin County. We have a full staff of physical therapists, athletic trainers, occupational therapists. So if you have some kind of condition that requires therapy, we can take care of you. We have speech therapists, audiologists, everything. So we're really very proud of what we've been able to do previously on the CV campus, but also here. I mean, this is just a great facility.
I can tell you, when Mike Hildebrand said it's Bob's baby, he wasn't kidding. You really take this seriously, don't you?
Well, we do, but a lot of people went into making this a successful program. Before we moved over here, we worked with the staff who were going to work here. How should it be laid out? Heck, we even asked them before we moved, should we be moving? And one of the big things our staff told us was, gee, we just don't have enough space down at CV to really do what we need to do. Can't we get some more space? So it's really been a team effort. I get to sign the checks, but a lot of people other than me do the work. I mean, and as we go through, hopefully you'll get to meet some of those people and be able to get a little insight from them. And as you can see, they saw the camera coming, so they've all disappeared.
Of course, empty spaces. I faced that for years with microphones, and now with cameras, it's even more. All right, what's next, Bob?
Upstairs. Upstairs is the health club portion, primarily. And again, if you were a Bay Club member, you'll remember upstairs there was a lounge area. We've converted that all over to an aerobic studio, complete with...
The bar's not here anymore.
No, the bar's gone. No, that was part of our wellness and prevention. But we converted this over to an aerobic studio, and I'll let you in on a little secret. You're standing on imported fabric. It came from France.
Oh, my.
So
that's neat.
And back behind this area, again, was an old racquetball court that we put a second story on and put, again, some more weightlifting and cardiovascular equipment in. So this is really the area that the club members use for their strength and conditioning. And this works out to be a nice area, particularly in the summer and the fall. The sun streams in. Club members get a sense that there's, it's a bigger room. You're not locked up in a closet, staring at the same four walls. So it works out really well. And we have a full set of locker rooms and support space back behind these doors. So basically, the second floor is really for the health club members. And at this point, the Y has over 350, almost 400 health club memberships. And the nice thing about the memberships are that you can belong to the Y downtown, like I do and perhaps you do, Gordy. And if you want to use this facility, you just pay a little extra more and you have dual membership. You can use either facility. So it works out great. because it's not always convenient for me, as an example, to run downtown after work because I'll have a meeting out this way. So I stop in here and exercise sometimes. And it's just really helpful to have the facilities in both places. And that's upstairs. If we go downstairs, we'll show you the pool, which is really something that, for our purposes at CV, has really worked out real well. Aquatic therapy is one of the fastest growing portions of physical therapy medicine across the country, and we're putting it to good use. So I'd like to show you the pool.
We'll do it in just a moment. Every time I see this pool or the Y pool, I think of Loyal Wright, whose picture was in the paper the other day.
Yeah.
The soul and inspiration for anybody who's ever been in a pool, 90 years old. And how many lives do you think he's touched?
Hundreds, if not thousands. just an amazing story. Well, we're obviously at the pool here at the Bayside Wellness Center, and the reason we wanted to spend a few minutes here is this is really something that we're very excited about. Aquatic therapy for physical therapy injuries is one of the fastest growing disciplines in America, and we're the only rehab provider north of Albany that actually has a pool that can be used to help patients who can't get around on land to do the physical therapy. This is really helpful for patients who have bad backs, or maybe they've fractured their hip and they can't put any weight on their hip. We have trained, certified staff that get in the water with the patients, and patients just love it. We use the pool 3 days a week for patients, and then the hours in the day that we don't use it, the Y uses it for swimming programs, swimming classes, open lap swimming. I'm an open lap swimmer, so that's near and dear to my heart. So this pool really gets a lot of use, and if you remember the days of the Bay Club, you'd come in here and you'd see some people in here splashing around, but now this pool is really put to a great deal of use. It's really a wonderful asset, and we're just thrilled to be able to offer an additional service to our patients in Clinton County. It's just wonderful.
You know, it's not ludicrous, but at least humorous to me to hear you talk about what a wonderful thing water exercise, aqua exercise is. We've, you know, there have been a lot of people doing that for a lot of years, but all of a sudden, in the last year or so, I'm seeing network television shows discovering aquatic exercise.
Everything old is new again.
Isn't that amazing? But you're right, it is the fastest growing thing.
Right. Well, for years people didn't want to recognize that it really makes a big difference, but the amount of weight that you carry when you're in the water is reduced somewhere on the order of 20 or 30 times. So you can do a lot more exercise, get almost the same level of conditioning in the water as you do on dry land. So it's just great. And you're right, Gordy. Things just, you know, old ideas that people kind of thought made sense, suddenly they come up and they make a lot of sense. So, and that's what we're finding here.
Not just for senior citizens, for young people's aerobics, and for therapy, and for the whole bit.
Yep. We hope we do deal mostly with patients who have injuries now, but eventually we want to get into programs, strength conditioning for athletes. It's racehorses. This is where it was first done. Racehorses, when they have an injury, they put them in a big water tank and they run them. Well, you can do the same thing with a high school athlete, a track star. Once they get in the water and they run, their conditioning level goes up dramatically compared to all those miles you'd have to put on your knees and legs and feet running around town. So we hope to get into those kind of programs. So we just think the possibilities are endless here. And again, we're just so pleased that we're able to do it for the community.
Bob, did you swim in school competitively? Or?
No, I was a rock in school, Gordy. No. But as I've gotten older, I found that running around in these track shoes really takes a toll, and it's a heck of a lot better to get in the pool and exercise all the muscles.
Yeah, let's get a little bit about your background. Where are you from? And you told us you hadn't been here for a long time. Where are you from, and your education, a little background?
Right. Well, I'm originally from downstate. I'm a downstater. Grew up in the city and spent my entire life there. And gradually, after going through college, went to graduate school to work in hospitals specifically. And I've moved around mostly the Midwest. Many locations similar to Plattsburgh, smaller communities where you can really get to know people and where you have an opportunity to do something that really makes a difference for people. And I've been here now almost 6 years, and this is one of the projects that I've worked on. I'm fortunate to work with a great team of people at Champlain Valley, all the way down from the president, Kevin Carroll, to Mike Hildebrand, somebody you deal with a lot. We just have a great bunch of people, and it's just been a pleasure being here. I mean, I couldn't have asked for a better location and a better crew of people to work with.
You better be careful. You might get some roots down here.
Well, I've got some roots. I mean, we really enjoy living in Plattsburgh and Clinton County. I've got friends who live all over the country, and they say, you ought to come visit. And I say, well, do you have a lake? No. Do you have mountains? No. Are people friendly? No. Then why would I want to leave Plattsburgh?
Boy, I couldn't put it any better than that, Robert.
And Gary Douglas is going to send me the check from the Chamber of Commerce.
He's not very far away. And by the way, we're taping this on the 2nd day of October 1998. They're going to be in for a massive move this week. Yeah. Those people are going to be very busy folks.
Yeah, in fact, I called Gary today, and they are moving today. So
I think today's the day.
So next week you can get over there and see their new facility. But
we won't go over today. They make me carry some boxes.
Yeah, right. Yeah. Well, don't do that. That reminds me, another program we have in this facility. We work with a lot of local companies in a program called the North Country On the Job Network. It's actually jointly sponsored with the Chamber of Commerce, and what we do is we deal with injured employees, and it's a great program. Gary and his staff at the Chamber have been very supportive. We have over 40 companies that we deal with, and it's been so successful helping injured employees get the care they need and the therapy they need that it's been recognized nationally with a very prestigious grant. We're one of 9 programs in the country that's received a Robert Wood Johnson Foundation grant. And again, that's a program we're able to do here that we weren't able to do downtown at the main campus because we just didn't have enough space.
Wonderful opportunities we have for a relatively rural area of northern New York. I hate to put them on the spot, but has your impression of Plattsburgh and Clinton County changed a little bit? Based on your preconceived notions as a young person down around the city?
I was a true downstater, Gordy. I thought upstate ended at Albany. I had relatives who were in the legislature, and they used to say, I'm going upstate, and that meant Albany. Well, when I moved up here, I now call my relatives, and I say, come on upstate, and they say Albany, and I always say, no, it's the better 2.5 hours north of Albany. So
I do love it. Robert, thank you so much.
Gordy, it's a pleasure having you here, and anytime you want to come back, please don't hesitate.
We'll do it.
Every blood vessel shows.
Oh, yeah, and you just got on camera saying that too, Mary Noon.
I did?
Mary Noon, how are you?
I'm just fine.
And you didn't really come in here on your day off
Yes,
and
I
juggle
did.
your whole schedule around
Yes,
just
I
to be
did.
with us.
Sure,
Oh, gosh,
always like to promote the business here.
I hope we can live up to those expectations. What is your connection with this wonderful facility, Mary?
Well, we are Outreach Nutrition, and I have a full-time diet clerk that works with me who is also off today. We work 4 10-hour days so we can meet the public needs because the public likes to be here in the late evening and the late afternoon and the evening because it's much more amenable because most of our clients do work. So we try to provide them times that they're able to come.
So what's Outreach Nutrition?
Outreach Nutrition. I do individual diet counseling. I'm a certified diabetes educator. I do a lot of diabetic education individually. Teach people how to do blood glucose monitoring, adjust insulin levels, that type of thing. We have...
Reminds me, my son Dale was over there last night right after I had a large evening meal with his little kit, and he comes out and pricks my finger.
Your son is a diabetic.
Well, he's borderline, and
There's no such thing as borderline.
Oh, there isn't? Tell
No.
me. See, maybe I can educate him, make believe I'm smart when I get home
The
tonight.
new diagnosis of diabetes is a fasting blood sugar greater than 126 on 2 separate occasions, or a random of 200 on 2
I wasn't
separate
fasting
occasions.
when mine is taken, so that 168 doesn't count.
That's a little higher than it should be.
Even after a big meal,
Yeah.
Come see Mary.
That's right. Because I think, people don't do as much to help themselves at the stage of their diabetes that they could if they don't really think they have it. So, if he's got his little kit and all that good stuff, I think he probably has what we call type 2 diabetes.
Type 2?
Mm-hmm.
He's on medication,
Well,
I
if
know.
he's on medication for it, he is a diabetic. He is not borderline.
Okay. Well, see,
Okay.
I learned
That's
something
an
every day.
that's an education that really has to get out because a lot of people they don't take insulin, they don't think they have it, so therefore they don't do as much with it. And we know the sooner we get people in good control or good management, the less complications they have. And I think you toured the kidney unit today.
Oh, yes, we did.
And I think you will find that 85% of the people on the dialysis unit have diabetes. It's probably it is the leading cause of the need for dialysis. So that's a really big deal. And, it causes blindness and amputations and heart disease. So it's really important to get on top of it as soon as possible.
Absolutely true. Tell us a little bit about your background, Mary. Where you came from?
Let me finish all of my programs.
She's got the pitch. Never mind.
Got more.
Go ahead.
We do a liquid diet program here called NutriMed. We have 8 different classes a week, all at different levels. It's a 22-week program where they are on a liquid product, where they are monitored medically. We check them every week. We check their blood pressures, their ketone levels. We counsel them every week. They have a class for 22 weeks every week on behavior modification and nutrition. And at the end of that period of time, when they're no longer on product, there's a maintenance program for them to go into for 1 year after that to help them sustain their loss. We get people with losses, up to 125 pounds in 4 months. So it's been a real positive. People get really upset when they can't lose weight on a conventional diet. And this isn't for everyone, but it is, something for people that have a lot of weight to lose. We wouldn't put anybody on it just for marginal weight loss. You want my background?
Well, okay. I was going to wait for you. I didn't know what else you had.
We do. We're going to be restarting our diabetic education program because Medicare is now covering it, which is new. It hasn't met in the past, so that's been a big problem. People that have a medical condition feel their insurances should pay for it. And it's hard when insurance doesn't cover something to get people to believe they really need it, but we do individual counseling on cholesterol, to lower cholesterol and weight. I do quite a bit of eating disorders, gestational diabetes. We do a little bit of everything here for individual counseling. An individual consult lasts about an hour, a little bit longer for a diabetic. Weight losses are a little bit easier. We encourage people to come back because to stay focused, I think that's really important, to think you have to report to somebody. I've been at the hospital for 36 years, so I've been here a long time.
There for a while.
This is my anniversary actually.
Is it really?
36 years, yeah.
Wow.
I started at the old Champlain Valley Hospital teaching at the School of Nursing. And it's still there, but most of the hospital I started with is torn down. Came over when they put the 2 hospitals together. I think it was 1965 when it came over to the old Physicians Hospital before it became the CVPH Medical Center. Went through all that construction. Have seen a lot of changes, a lot of bosses, a lot of administrators over the years. But it's been a real fun time. I really enjoy it. The people are wonderful, and patients, most of them are a lot of fun to work with, and they almost become like family. I graduated from the University of Vermont. My master's degree from Plattsburgh PSUC, and I have a certification as a diabetic educator. And I'm registered dietitian, which means I spent an extra year after my BS degree.
I'm going to show this tape to my granddaughter Megan, who's a freshman at UMass at Amherst and majoring in food and nutrition.
Wonderful.
I'm going to tell her where she can be in 36 years, working at the wellness center down here.
Right, because I think I'll be retired by then. But yeah, it's an exciting new world. I can remember a nurse saying to me when we started charging for things on an outpatient basis, "You mean you're going to charge people for that?" Uh-huh. But I think nutrition has taken a lot of new turns. There's a lot more things to do. Like today I was working home care for the Clinton County Health Department. When I came off the road, I hurried back from Merrill, New York, and actually left my
She
bag
just tried to make me.
there.
Oh, did you really?
Yeah.
That's like Calvin leaving his camera up at the other place, and we were almost on our way down
Yeah.
here.
Well, I think it'll be next Friday before I go retrieve it. But and that's a whole different thing because you get to see people in their homes. and what they can really do. And because a lot of times you have kind of an artificial impression about what people can do in the hospital setting, because you have them kind of, they're doing what you tell them to do in the hospital, but when they get home, they're a little bit more independent. They feel secure in their own homes. So you see what they're really dealing with a little bit more.
Perspective is good for you. I'm just thinking about how valuable it is for me as a victims services advocate to see people in the home, to view the setting, to see what the family dynamics are.
Right.
Sneak a look in the refrigerator.
I never look through cupboards unless they ask me to. Okay, I learned that very young, and that you don't go opening cabinets in a client's home unless you ask permission to do it.
Give you a perspective just to walk in the door.
Very different perspective. I always say everybody should go with a home care nurse or a home care person at least one trip, because it's a very different world out there. I've been chased by roosters.
Now here comes the good stuff. Chased by roosters, yeah?
On home care, yeah. Had a goat in one house.
Oh, man.
Oh, you see a lot.
A goat in the house?
Yes, we're up in the North Country, and yep.
I know somebody with a potbelly pig.
We have some baby kids up on the snuff unit, don't we, Mike?
Oh, yes.
Yeah. Yeah, in a playpen, I believe.
Yeah, I'm getting the real inside dope here.
Animals are a very rewarding thing for older people to have. They can talk to them. They don't answer you back, particularly dogs. Cats are a little more independent.
My dog talks to me.
Mine does too.
Trying for 6 months to teach him to say, I love you. I say it way better than he does.
Yes, I'm sure you do. But we're kind of excited to be out here, to be able to offer some exercise with the programs. The Y has waived the joiner's fee for all our clients out here. I don't know if PT told you that, rehab told you that. So that we try to encourage the people to exercise, and in the North Country that's hard to do in the winter, especially the past winter when you kind of slipped and slid a little bit. So they can come in here, even if they don't have a membership. There's senior swim for $1 for every Monday, Wednesday, and Friday. There's lots of things they can do here and see other people in the same boat they are. And
is this a good part of your career?
What?
Right here, right now.
Oh yeah, I love it here. It's really, at first, I never thought I'd spend the end of my career out of the hospital. And the only thing I kind of miss is the peer company. You get out here and you get a little bit isolated, but then you get more work done too, because
I was going to say there's a lot to be said for that.
A lot of interruptions when you're out here, so I do find that I don't have to go through the cafeteria twice a day and get tempted, which has been very helpful to me. They have lots of good food in that cafeteria, no matter what you hear. And it's very easy to see those great big cookies, Mike. Yeah. That can get any.
Doing it to me again. I may have to enroll in this program before we leave.
But, nobody should enroll in any program unless they really want to do it. They should do it because they want to do it. I think
everything works from the inside out.
Changing your lifestyle is really from the inside out. Just because your husband's telling you have to do it, or the doctor's telling you to do it, until you tell yourself you have to do it, you're never going to do it.
Got it down pat.
Yeah. But changing a lifestyle is not easy. You don't do it overnight, and you do the best job you can every day. I kind of like Oprah's philosophy. Take each day at a time, learn from what you did wrong the day before, try to change it the next time the situation comes up. And keep a journal. She's been very
the journal thing is an idea, not to mention her book club.
Well, that's not nutrition, but yeah, I mean, she's struggled all her life, but all her successes, the thing she's had the biggest struggle with is her weight. So, and all the money in the world can't buy you weight loss. So people say, oh, it's easy for her. She has a trainer and all that, but she still gets up at 5 o'clock in the morning and does it. And I think the one thing that people, they'll diet, but they don't exercise. And so, therefore, they put it back on, and they say, oh, that diet didn't work, I put it back on. Well, if you go back to your old eating style, and you don't exercise, I guarantee it will go back on.
Yeah, and that, you can take that to the bank.
Right. Yes, we sure could.
Thank you so much for having us here today. Thank you for making special. She's making me feel bad, making a big trip all the way down through.
Anytime I told Mike that I can advertise our business, that's what's important.
Do that. You're a wonderful person. Don't ever change.
Thank you, Gordy.
Thanks again. Have a great day. And we're going to end up outside looking in. Mike Hildebrand, Director of Public Relations. This has been a great day for Calvin and me, and I hope for all our viewers. Thank you very much for doing this.
Well, thank you for having us. We're glad that we can bring you into some of our newer facilities. But Gordy, at the same time, we're tickled pink with the new facilities and what they mean for the community. But it's very important also to emphasize that the strength of our organization still remains all those employees and physicians who are doing the work. It's just that now we have some newer facilities that allow them to do their work a little more conveniently and effectively.
And how about other things in the future that may be coming that we've only touched on today? I know you said there's a lot of growth within those hospital walls at the primary CVPH campus as well.
Well, that with the obstetrics program and the pediatrics, those are being remodeled, and we're excited about those. By virtue of creating the ambulatory surgery facility, it'll enable us to do some things we need to do within the existing surgery as well, and that's a positive spin. And we're looking at other programs. We would love to be able to do something in the way of an adolescent psychiatric program. The challenge with that, frankly, is trying to make it cost effective. But we're always, well, like any organization, you've got to be willing to change and grow with the times, and that's what we're trying to do.
I would be remiss if at the end of this program I did not mention a wonderful lady, Hannah Hanford, and the CVPH Medical Center Foundation. A fun organization, and I enjoy going over there once in a while to have breakfast with those folks.
Well, Gordy, you have been a great addition to that foundation board, but the foundation's a separate entity out there. They're our fundraising arm. They're involved in a lot of very positive programs for us, and certainly we'd have a hard time without them.
Great. Yeah, good coffee, too.
No complaints there, and don't forget the pastries.
Thank you very much, Michael. Have a wonderful day, and we'll see you again when some of those projects are finished.
Thanks again for coming.
And who knows where